You take your blood pressure pill every morning, right on schedule. You never miss a dose. But this morning you also took a potassium supplement, poured a cup of licorice tea, and swallowed a St. John's wort capsule your neighbor swears by. And none of that shows up as a medication on any chart at your doctor's office. A 2022 study published in the Journal of the American Heart Association followed over 2,600 adults over 60 and found that nearly 1 in 3 were combining a blood pressure prescription with at least one supplement capable of interfering with it. Almost none of them had ever mentioned it to their doctor. Not because they were hiding it, because nobody ever asked, and nobody ever thought a bottle from the health food store belonged in the same conversation as a prescription. 5 specific supplements show up most often in that dangerous overlap. Your body handles every one of them differently after 60 than it did at 40, and there's a simple 4-step check you can run this week, on your own before your next appointment, to find out if anything in your cabinet is quietly working against the pill you rely on every day. Here's the problem. When your doctor prescribes a blood pressure medication, they run through a mental checklist of other prescription drugs that might interact with it. Ask about a supplement, though, and the conversation usually stops there. Supplements live in a strange legal middle ground in the United States. The FDA classifies them as food, not drugs, which means they don't go through the same interaction testing, dosing standardization, or manufacturing oversight that a prescription medication does. A 2019 analysis in the American Journal of Medicine reviewed emergency room visits linked to supplement use and found that adults over 65 accounted for the largest share of supplement-related adverse events serious enough to require medical attention. And a significant portion of those cases involved heart or blood pressure medication. Separately, a Mayo Clinic pharmacology review found that fewer than 1 in 5 patients on cardiovascular medications had ever been asked by a physician about supplement use during a routine visit. The people most likely to be on a blood pressure prescription are the same people most likely to also be taking multiple supplements. The overlap is enormous, and most of the time, nobody is checking whether those two lists are safe to run together. That gap between what your pharmacy fills and what sits in your kitchen cabinet is exactly where dangerous interactions hide. Not in a hospital, not in a lab, in the space between 2 conversations that never happened, 5 days a week, in millions of households. And it isn't a small or rare problem. A 2020 pharmacy-based screening study across 14 U.S. states found that among patients over 60 taking any cardiovascular medication, nearly 40% were also taking at least one dietary supplement with a documented interaction risk, and fewer than half of those patients had that supplement listed anywhere in their medical chart. That means the interaction risk isn't hiding in some rare unlucky case. Statistically, it's sitting in almost half the medicine cabinets of people watching this video right now. So let's go through this mechanism by mechanism, starting with the one most people don't even think of as a supplement: potassium. If you're on an ACE inhibitor like lisinopril, an ARB like losartan, or a potassium-sparing diuretic like spironolactone, your medication is already working to help your body hold on to potassium while it lets go of sodium. That's part of how it lowers your blood pressure. Now add a potassium supplement on top of that, or a salt substitute, which is very often just potassium chloride, wearing a disguise on the label. And you can push your potassium levels into a range doctors call hyperkalemia. Here's the part that catches people off guard. Hyperkalemia frequently has no symptoms at all until it starts affecting your heart's electrical rhythm. A 2021 study in the journal Hypertension found that hyperkalemia significantly raises the risk of dangerous arrhythmia in older adults specifically, because aging kidneys clear excess potassium more slowly than younger ones do. Think of your kidneys as a drain. In your 30s, that drain runs wide open. By your 60s and 70s, that same drain has narrowed, not blocked, just slower. The same amount of potassium that used to clear through in an hour can now take 2 or 3 times as long. So a supplement dose that was perfectly fine at 40 can quietly accumulate at 65, especially layered on top of a medication that's already nudging your potassium levels upward. This is exactly why so many people say, "I've taken this for years, nothing ever happened." right up until the year their kidney function had declined just enough and their prescription had changed just enough that the math finally tipped over. A routine blood panel is the only way to catch this before it becomes a symptom, which is why doctors who do know about a patient's potassium supplement use will often order more frequent labs. The problem is, most doctors don't know, because most patients don't mention it. When hyperkalemia does become symptomatic, the warning signs are easy to dismiss as ordinary tiredness, muscle weakness, a fluttering or irregular heartbeat, mild nausea, a general sense of heaviness in the legs. A 2020 review in the American Journal of Kidney Diseases noted that emergency hyperkalemia cases in adults over 65 rose specifically alongside increased combined use of ACE inhibitors or ARBs with potassium supplements or salt substitutes. A pattern the authors called largely preventable with basic medication reconciliation. Preventable doesn't mean rare. It means nobody closed the loop. The second interaction hides in something that sounds gentle and old-fashioned. Licorice root. Not the candy. Most licorice candy sold in the US is artificially flavored and contains none of the real thing. We're talking about licorice root supplements, licorice tea, and some imported European licorice candies that use actual root extract. Real licorice contains a compound called glycyrrhizin, and glycyrrhizin does something almost nobody expects from a natural product. It mimics a hormone called aldosterone, which tells your kidneys to retain sodium and water while dumping potassium. In other words, licorice root does close to the exact opposite of what your blood pressure medication is trying to accomplish. A case series published in Mayo Clinic Proceedings documented patients who developed severe, medication-resistant high blood pressure purely from daily licorice tea or licorice supplement use. Blood pressure spikes that resolved within days simply by stopping the licorice, with no medication changes required at all. For someone on a diuretic, the danger compounds in both directions at once. The diuretic is already encouraging potassium loss, and licorice accelerates that loss further while simultaneously working against the blood pressure lowering effect of the drug. You end up with dangerously low potassium and stubbornly high blood pressure showing up in the same body, at the same time, from what looks like a soothing herbal tea. This is the trap of natural framing at its clearest. Licorice root sits on health food store shelves next to chamomile and peppermint, marketed for digestion, stress relief, or menopause support, with no warning label anywhere connecting it to blood pressure. Research on glycyrrhizin dosing has found measurable blood pressure increases at doses as low as 400 milligrams of glycyrrhizic acid a day, sustained for as little as 2 weeks, an amount that's easy to reach with just 2 or 3 cups of strong licorice tea daily, or a standard capsule taken along with an occasional piece of imported black licorice candy. Most people have no idea the amount adds up that quickly, because nobody is counting milligrams from a cup of tea. The third and fourth interactions come from a habit more than a single ingredient: supplement stacking. Most people over 60 taking a blood pressure medication aren't taking just one supplement. National Health Survey data shows adults over 65 average 3 to 5 supplements daily, added one at a time over the years. A multivitamin here, a joint supplement there, something a friend recommended, something an article said would help with energy. Each one gets added in isolation, and almost nobody steps back to look at the full stack against the full medication list. St. John's wort, taken by millions for mood support, is a perfect example of how this compounds. It works by inducing liver enzymes, specifically the CYP3A4 pathway, that break down a wide range of prescription drugs faster than normal, including calcium channel blockers like amlodipine and certain beta blockers. The result isn't a dramatic spike, it's the opposite. Your medication gets metabolized and cleared so quickly that it never reaches an effective level in your bloodstream. Your pressure creeps back up over a few weeks, your doctor sees the rising numbers and assumes the medication has stopped working, and the dose gets increased, when the real problem was sitting in a supplement bottle on the kitchen counter the entire time. Now layer in grapefruit or grapefruit seed extract, sold in some metabolism and immune supplements, which does the reverse. It blocks that same CYP3A4 enzyme pathway in the intestine, causing calcium channel blockers to build up in the bloodstream to levels far higher than intended. The FDA has specifically flagged this interaction because it can cause a sudden, dangerous drop in blood pressure, dizziness, fainting, falls. And there's a fifth supplement worth naming directly, Ginkgo biloba, one of the most commonly used herbal supplements among adults over 60, taken for memory and circulation. Ginkgo can independently affect blood pressure regulation, and the National Center for Complementary and Integrative Health specifically warns that it interacts with blood-thinning medications. A real concern, because a large share of people on blood pressure medication are also on a blood thinner for cardiovascular protection. Two supplements pulling one medication in opposite directions, and a third adding bleeding risk to the mix. None of it visible on a standard chart. There's one more layer worth mentioning here, even though it's less about a single supplement and more about a combination effect. CoQ10 and high-dose fish oil, two of the most commonly used heart health supplements among adults over 60, both have a mild blood pressure lowering effect of their own. On their own, that's often a genuine benefit. Combined with a full anti-hypertensive regimen, especially 2 or 3 medications together, which is common for people managing blood pressure alongside cholesterol or diabetes, that additive effect can occasionally push blood pressure lower than intended, leading to lightheadedness on standing, a pattern called orthostatic hypotension that raises fall risk substantially in this age group. So here's the protocol. 4 concrete steps, and none of them require you to stop anything on your own today. Step 1. Do a full brown bag review. Once a year, put every single bottle you take, prescription, over-the-counter, vitamin, herbal, powder, tea, into an actual bag and bring the whole bag to your doctor or pharmacist. Not a list written from memory, the bottles themselves. Studies on medication reconciliation consistently find that patients remember roughly 60 to 70% of what they're actually taking when asked to list it out loud. And the missing 30 to 40% is disproportionately supplements, because people genuinely don't file them under medication in their own heads. Step 2. Ask your pharmacist specifically for an interaction check that includes herbal and dietary supplements, not just prescription-to-prescription interactions. Most people don't know this service exists, and at most pharmacies it's free and takes about 5 minutes. Pharmacists have access to interaction databases that flag exactly the conflicts we just walked through: the St. John's wort and calcium channel blocker problem, the licorice and diuretic problem, the ginkgo and blood thinner problem, instantly, by name. Step 3. Read labels for 4 specific red flags before you buy anything new. Potassium content, if you're on an ACE inhibitor, ARB, or potassium-sparing diuretic, glycyrrhizin or licorice root extract, regardless of what the product is marketed for. Grapefruit-derived ingredients, which show up in some weight loss and metabolism supplements under names like grapefruit seed extract or naringin, and supports circulation or supports memory, claims on ginkgo-containing products, which is often the only clue on the front label. Step 4. Keep a simple home blood pressure log for 2 weeks anytime you start a new supplement. Same time each day, seated, same arm, feet flat on the floor, no caffeine or exercise in the 30 minutes beforehand. If your numbers drift more than 10 points in either direction after adding something new, that's your signal to call your pharmacist before you assume it's a coincidence or just a bad week. Write the supplement name and start date right at the top of the log page. When you do bring up a change with your doctor, being able to say, "I started this on this exact date, and here's what happened to my numbers over the following 2 weeks," turns a vague concern into something they can actually act on. Bonus habit worth building alongside these 4 steps: whenever a new prescription gets added to your regimen, even something unrelated to blood pressure, like an antibiotic or a pain reliever, ask specifically whether it changes anything about your existing supplement routine. Interactions run in both directions, and a new prescription can just as easily be the piece that shifts the balance as a new supplement can. Now, 2 mistakes that undo all of this if you're not careful. The first is assuming natural means safe enough not to mention. We just walked through 5 supplements: potassium, licorice, St. John's wort, grapefruit, and ginkgo. Every one of them entirely natural, and every one of them capable of destabilizing a blood pressure medication in a real, measurable way. Natural describes where something came from. It says nothing about what it does once it's inside a body that's also running on prescription drugs. The second mistake runs in the opposite direction, stopping a supplement or a medication abruptly on your own the moment something sounds concerning. Some blood pressure medications, particularly beta blockers, can cause a dangerous rebound spike in blood pressure if stopped suddenly and without medical guidance. The fix here is never stop everything today. It's call your pharmacist this week and let someone with the full picture tell you what actually needs to change. There's a third, quieter mistake too. Trusting a supplement recommendation because it came from someone you trust personally. A friend, a family member, an influencer with a warm, reassuring voice, rather than because it was checked against your specific medications. What's harmless for your neighbor's regimen can be genuinely risky in yours, because the interaction depends entirely on which specific prescription you're taking, not on the supplement being inherently good or bad. Here's the reframe worth sitting with. We're taught to think of the medicine cabinet and the supplement shelf as two separate categories, one serious, one optional. Your body doesn't make that distinction. Every capsule that enters your bloodstream gets processed by the same liver, filtered by the same kidneys, and acts on the same blood vessels, regardless of which shelf it came from or what the label promises. The 5 interactions we covered today aren't rare edge cases buried in medical journals. They're sitting in millions of medicine cabinets right now, taken by people doing everything they think is right, filling their prescriptions, showing up to their appointments, adding a little extra support here and there because it seemed like a healthy thing to do. The gap isn't in your effort. It's in a conversation that never happens, simply because nobody thought to ask, and nobody thought to mention. If this opened your eyes to something your doctor hasn't mentioned, hit the like button and subscribe. We cover what doesn't fit in a 10-minute appointment. Visit healthhustleacademy.com. We've put together the exact tools and supplement resources we talk about in these videos. All links are in the description. Take care of your body. Nobody else is going to do it for you.